A 22 years old lady is breastfeeding her first child 1 week postpartum. She present with tender indurated mass in the right breast. Infection with which of the following is most likely? So here this is a obvious feature of the mastitis, that means inflammation of the breast, and the patient is 22 years female, breastfeeding her first child. So what may be the organism responsible? Here the options are the Staphylococcus aureus, Streptococcus pyogenes, Streptococcus bovis, Klebsiella, and Streptococcus viridans. So which may be the organism which is responsible for early mastitis? So here we can see the mastitis. Mastitis is, that means the inflammation of the breast, and this mastitis refers to infection within the breast or inflammation within the breast, and it is the most common variant in case of the female. Lactational mastitis is related to the breastfeeding. So in this, the patient 22 years female, as it is breastfeeding, so it is lactational mastitis, and occurs as a result of the inoculation of the breast tissue with Staphylococcus aureus. So it is the answer that the Staphylococcus aureus is the most common organism for responsible such type of the mastitis. Actually, in any type of the post-operative period, in any surgery, after any surgery, if you cannot remember any organism, first look for Staphylococcus aureus. And this is carried in infant oropharynx. That means the Staphylococcus aureus usually present oropharynx of the baby, and it results in tender erythematous breast with fever, and fever is very, very common in this female. And what is the treatment? It increases the drainage of the breast by breast pump and also the antibiotic, and the help of the imaging technique, usually ultrasonography, is enough for diagnosis of the underlying pathology. And the treatment is percutaneous aspiration required when there is abscess formation, or when there is no abscess formation. In this condition, the sucking of the breast and the pumping of the milk from the breast is enough with antibiotic coverage, and sometimes there is a requirement of the debridement. But there is a complication, which is the mammary duct fistula. So sometimes there is a chance of development of the mammary duct fistula. So what is the most common organism for the mastitis? It is the Staphylococcus aureus. Other options here, such as the Streptococcus pyogenes, it is not true. Streptococcus bovis also not true. Klebsiella, it all usually found in the gastrointestinal tract. Streptococcus viridans also not true. So only true option is the Staphylococcus aureus, and it is the most common pathogen for development of the mastitis.